All right, welcome to the fourth and final presentation of your Coronal polishing didactic content. This last lecture is about home care products and techniques, and then also how you are going to register with the Ohio State Dental Board, which is super important. So first things first, it always takes like 13 clicks to get going here on this first one. All right, so it's really important that you all floss when you're finished with coronal polishing because we want our patients to floss. And if we don't floss when we're finished, then they're not going to think that it's important and then they're not going to do it. So make sure that you take the time to floss every patient whenever you're finished with your coronal polishing. It's really important because it can help to identify areas that are maybe still a little bit rough that might still need a little bit of attention, like with scaling. You can remove some residual plaque that just maybe you missed with your coronal polishing, or maybe that was missed as part of the scaling, and then also to educate the patient. So this is prime time to hand your patient a hand mirror and just have them watch you while you floss and just talk about your technique. To explain, you're going to make a C-shaped technique, which we're going to kind of talk about the techniques here in a few minutes, and I have a little video. But this is the way that you're going to do it. This is where you want to do it. This is how you're going to do it. And if they can have that hand mirror and watch you, then that is an excellent time for you to be doing that patient education. Again, just please make sure you're flossing all of your patients. Toothbrushing, as you can imagine, does not reach interproximally. So you have to do something. You have to somehow remove all of that plaque from underneath the contacts and in between the teeth. And so floss is the best thing to use for really tight contacts, but it is definitely not the only option. And so we'll talk about all the other things that you could potentially recommend to your patients. But the big thing is that floss is, although the most commonly recommended probably, and it's really important to teach our children patients how to floss so that they can start that habit early, and hopefully they can do it for life. So really making sure to educate them. I'll probably say this again in the in-person session, but I have found that we as hygienists might do a good job like kind of talking to patients when they're talking to their parents when they're really young. And then at some point we're like, well, maybe they're not going to quite understand because they're a little bit too young. And then maybe we forget and we don't tell them or teach them. And then next thing you know, they're adults and we expect that they do know how to floss, even though they may have never been taught before. So usually with all of my patients, no matter how old they are, I always just say, I'm going to just go ahead and talk you through my technique for how I floss. It might be different than what you're used to. So if you've heard this before, then just ignore me or something silly, like I mentioned before. Sometimes if you approach things with a little bit lighter heart, then they take it a little bit easier. So we'll talk a little bit about motivational interviewing. So this is just like a technique that you can use to get your patients on the same page as you and to try and help them make a behavioral change without it feeling like you are lecturing them or harping on them. And so you want to use motivational interviewing while you're discussing their home care, and you want to ask them questions. So you want to be talking to them about what types of products do they use, how do they feel like those products work, what is challenging about the products that they are using, how do they feel about the health of their teeth, what would they like to improve themselves? Because a lot of times patients know, like, oh, I want my teeth to be whiter. That's the next point, is like you have to find out what is going to motivate the patient, and you have to use that to your advantage. If it's about aesthetics, well then let's recommend things and talk to them about how plaque removal and stain removal on a daily basis will help keep their teeth whiter. Are they motivated by money? Do they not want to spend a bunch of money by getting their teeth filled all of the time? So how can we prevent them from needing a filling? So talking to your patients about what their desires are and also what is motivating them is a really great way for you to help them identify ways of improvement, and then to really start to think about what kind of goals you might set. And you want to work with your patient to establish these goals. And then that way, they like are kind of buying into the recommendations, and then you can measure the goals the next time they come in. And so one thing that, you know, is just an easy thing to think about is flossing. If your patients never floss right now, but they are interested in trying, then maybe a reasonable goal might be to get them to floss once or twice a week. That doesn't seem like very much to us because we want patients to floss every single day, but that is an improvement. And so we have to take baby steps sometimes. So let's set a measurable goal, and then we'll reevaluate it the next time they come in. And then maybe if they have now hit the once or twice a week, now maybe we can increase it to 3 or 4 times a week, and then just get better and better with each visit. Some of the like principles for motivational interviewing are here on the slide. The first one is rule. So R is resist the writing reflex. So it's like, I know it's right and I like to be right. So let me tell you what's right and tell you why you're wrong. But let's try not to do that because that's not really received very well. U is understanding the patient's motivation, like we just talked about. L is listening to your patient. You can learn a lot from listening to your patient. And you don't want to always be the one talking because, you know, I don't know about you, but I mean, I like to talk, of course. But I also like it when people are listening to what I have to say. I don't want to just, I don't want it to be like a one-sided conversation. And then you also want to empower your patient. So for those patients that are never flossing, well, what are they doing that's really well, that they're doing really well? And how can you make them feel better and, you know, give them props for doing the things that they are doing, while also trying to help encourage different behavior and something else. So just keep that in mind. We definitely don't want to should anyone. So like, oh, you should be doing this, you should be doing that, you should be doing this, because that doesn't make anybody feel very good. And then, of course, we're the professionals, so we want to provide our advice and our opinion, but we also really want to take their consider their thoughts and opinions into consideration also. And we just really want to make this a partnership and work together to help our patients to improve. So as it comes to home care, patients always ask, oh, what kind of floss should I be using? And the answer is whatever kind of floss you're going to use, because there are so many different things to choose from. And if you haven't been down the like dental care aisles at your grocery store lately, you should go because it's overwhelming as a dental provider, much less as you know, your patients. They have so many options, and they don't know what to pick. And so I have, you know, read some research, and it really doesn't matter. All of the flosses typically work about the same. And so there are benefits to using certain types of floss depending on what the patient presents with. But generally speaking, if they're willing to floss, take them up on it, whatever it is that they have. And then the next question, again, this is still going on about what type of floss. Anywhere where patients have tight contacts is going to be great to utilize the floss. And then if they have larger embrasure spaces, maybe you can use the thicker floss or the that's like tape or ribbon. But again, there are other options. So now patients usually ask like, well, how should I floss, or when should I floss? And when should you floss? Again, whenever you're going to do it. I don't care when you do it, as long as you do it. So either before you brush or after your brush, it doesn't matter. How you're going to do it is you really want to wrap the floss around your middle fingers. And this is for us as providers, but you can also teach your patients to floss in the same manner. So you're going to wrap most of it around one finger on one of your hands, and just a little bit on the other hand. And then you are going to use your index finger and your thumb to kind of like manipulate it and maneuver it into the places where you want it to be. And then this picture here in the lower right-hand corner really does a great job of showing you that you only want to have like maybe about a half an inch or so in between your fingers that you're utilizing, so that you have more control. And then as the floss gets dirty, you want to inch it over so that you're not putting the dirty floss in between each interproximal area. And then once you get where you need to go, you kind of want to shimmy it down in between the contact area. You don't want to like jam it down and you know, pound down up against that interdental papilla, because patients can get traumatized by that. And so you just want to be careful with that. Also remember, like sometimes people are going to have really tight contacts, sometimes they're going to have really light contacts, and that's not a one size fits all on the patient. Like I have like decently tight or normal-ish contacts, I would say, but between 11 and 12, I don't really have much of a contact at all. And almost every time, unless I have a left-handed hygienist, they like can't see it when they're coming over to this side, and they always jam it up onto my papilla there, and it never feels great. So I have felt it, and I don't want to be that provider, and I know you don't want to be that provider either. So just be careful. You want to provide or apply a little bit of pressure, just not too much, because you don't want to hurt the patient. Then once you get bust through that contact, now you're going to really hug up against the tooth, and you're going to go up and down, 3 or 4 times. And then you're going to come up over that interdental papilla and then come and hug the other tooth, where the other tooth that's coming in contact there. And then you want to go up and down, 3 or 4 times to go on that tooth. And then you'll pop out through the contact and you'll go to the next area. You can see here, we oftentimes explain it as a C shape, so like the letter C around the tooth. I always remind my patients that it's important to floss behind their last tooth in each area, because oftentimes patients forget, and I usually say that to them. I say, you might be able to feel that I'm flossing behind your last tooth right now. This is often a time that's an area that's forgotten, so just make sure that you really get all the way back here behind your last tooth and floss. And then for the mandibular arch, oftentimes we'll kind of stretch and push with our index fingers and use that to guide the floss. And then for the maxillary, it's kind of like a combination between your index finger and your thumb, whatever it is that you need to do. It kind of starts to feel comfortable, and then it becomes normal and you don't even think about it anymore. Traditional floss is not the only tool that you can use, of course. If you're still sticking with floss, but you have a bridge or you have ortho or whatever the case may be, you might need to use threaders or the little flossers. If a patient has big fingers that they can't really fit in there, then these little flossers are nice down here because they can kind of stretch and reach back there. And these flossers, if you've never used one before, this you put traditional floss on this and then you replace it. But of course, they always have those little disposable flossers that you can use also. Here are some alternatives to flossing. And so we have proxy brushes, I would say, is probably like my next most recommended product. And so here's an example of of a proxy brush here. They come in all kinds of sizes, shapes, brands, tons of different options. I think there's one, and I like almost always forget what the name brand is. You'll have to remind me to look them. You'll have to remind me to look on my phone during the in-person one, because it like escapes me every time I try and say it. But that in particular brand has like, I don't know, 8 or 9 different size options. It's crazy. So if somebody can't find one that's going to fit their perfect little embrasure spaces in that brand, then I don't know what to tell them, because there's literally like 8 or 9 different sizes. And this brand here, they have like extra tight or ultra tight, tight, whatever, and then wide and ultra wide. So several sizes there too. But you can use air flossers or water flossers or rubber tip stimulators. There's all kinds of options to alternatives to flossing if your patients are interested. Again, it doesn't necessarily matter what they're using, as long as they're using something interproximally. The research does say that interproximal brushes are just as effective as floss, and sometimes even more so. And I think that the reason why they might be more so I think there's a couple different reasons. One, if you have real big embrasure spaces, that tiny thin little floss might not be able to really pull out all of the plaque that's getting stuck in between your teeth. Whereas an interproximal brush that maybe is a little bit wider really can pull out a little bit more of that plaque. But then also there's like a technique piece to that too, right? Like patients might not necessarily be flossing properly, but it might be a little bit easier for them to use an interdental or an interproximal brush. Like technique wise, it might just be a little bit easier. So that could also be why they are a little bit more effective sometimes. Okay, so big things about that is just to remember that there are tons of products available. You need to make individualized recommendations for your patients based on what it is that you're seeing intraorally. And it's not like one size fits all for all your patients. So really take into consideration what you're working with when you're making these recommendations. Okay, so the last thing here is registering for the Ohio State Dental on the Ohio State Dental Board's website. So becoming a coronal polisher takes a few steps, right? So right now you're here, you're listening to all the didactic content and you're almost finished. And then you're going to come to campus and we're going to do in-person practice in the lab and then practice on each other in a clinical setting. And then you're going to take a quiz in which you have to pass with a 75%. So make sure you take the time to go through this. If you've kind of been skipping through it, maybe go back and look at some of the things that I have underlined and bolded, because those are the kind of key things that you want to remember for sure. And then when you come in person and we do the clinical piece, you'll also do like a clinical evaluation. So that's part of it. And then after you leave us, you'll also have to register with the State Dental Board. So it is a $19 fee, but once you are a coronal polisher, you're always a coronal polisher. So it's just a one-time fee. You don't have to take any continuing education courses to like, and then renew again or anything. It's just once you finish with the course, you have 90 days to, I almost said 30. You have 90 days to register with the dental board and pay your $19 and then you're good to go. Okay, so you'll want to go to dental.ohio.gov and you can jot that down, but it's also listed right here. And this is the Ohio State Dental Board's website. I'm sure you guys have been on there for other purposes, but this is where you're going to go also to register. And you're going to click on the licensing and renewal tab up at the top. And then here there is, a laundry list of options. You guys are obviously going to select coronal polishing. And then for all of you, this will be your initial application. And then you will complete the application. With this, you do have to be certified, which all of you I'm sure are. And then you have to complete the exam or the course as well as with the exam. And then, like I said, it is that $19 fee. There are laws in Ohio based on coronal polishing. So a lot of them I already talked about, like the score you have to get in order to pass the course and the application fee. Another thing to remember is what are the laws and rules as you're practicing? So what things can you do? What things can't you do? All of this is listed on the Ohio State Dental Board's in the board's website in the Practice Act. One thing you guys, I would just like to draw attention to is that dentists cannot supervise more than two coronal polishers at a time. And so if you are practicing as a coronal polisher at that time and there's only one dentist in the office, then only one more coronal polisher can be working. Now, if you have multiple dentists, then you can multiply the number of dentists times two, and that's how many coronal polishers can be working at a time. And keep in mind that this is separate than hygienists. So if a hygienist is coronal polishing at the same time as you, they don't count as a coronal polisher, like the two coronal polishers, they count under hygienists, and each dentist is able to oversee 3 hygienists. Okay, and then if you haven't seen it, this is kind of a nice reference that you guys can print off from the Ohio State Dental Board's website if you'd like and kind of post in your office. It has all of the auxiliary duties for, all the dental auxiliary duties. And so dental hygienist with when a dentist is not present, EFTA when a dentist is not present, certified assistant when dentist is not present, and then BQP, and what you can and cannot do if you're one of those auxiliary people. And so it's just nice to have as a reference to run over and be like, oh wait, am I allowed to do this? Am I not allowed to do this? How does this fit in with me? That's just like a food for thought if you're interested. All right, and so that is all. This was the end of your last lecture, and I just want to say that I am thankful to all of you for choosing our program, and thank you for taking the time to listen to all of these lectures. And I'm looking forward to seeing you all very soon and working with you in person for the practice portion of this course. So thank you again. Have a great day.